me a cue, I guess. Yeah. Ready?
So good morning, and I would like to thank everyone for coming. My name is Prasanna Alston. I am the Interim Executive Director for One Brooklyn Health Interfaith and Medical Center. I also want to give thanks to our Congressman Hakeem Jeffries and Congresswoman Yvette Clarke for being here and allowing us to participate in this very important conversation regarding the destabilization of Medicaid. I would now like to introduce Dr. Jason Hirschberger, who is the chair of our psychiatry for One Brooklyn Health.
Thank you, Dr. Alston. Thank you, Congressman Jeffries. Thank you, Congresswoman Clarke. Thank you for all the fierce advocates in this room here to defend Medicaid. It's my honor to start this ceremony and introduce Congressman Jeffries on this very important topic. You know, being poor in America is really difficult. It's really hard. It's really hard. But one thing that provides stability and hope for people going through that is Medicaid. Threatened cuts to Medicaid sow fear across our country. It sows fear here in the inner city. It sows fear in rural counties of New York City. It doesn't matter if you're a red state, a blue state, everywhere. Everyone in America is affected by Medicaid cuts. So I'm very honored to introduce Congressman Jeffries, who is the House Minority Leader. He's been a great advocate for health equity, for mental health initiatives, because I'm a psychiatrist, and for the safety net hospital system that provides hope and care for people who really need it.
Thank you. Good morning, everyone. Thank you, Dr. Hirschberger. Thank you to the chairman, the entire Interfaith Medical Center team, as well as the One Brooklyn Health team for all of the tremendous work that you do on behalf of the people that Congresswoman Clarke and myself are privileged to represent here in Central Brooklyn. I want to thank George and the SEIU family for all of the incredible advocacy and work that you do, 1199 family, of course, Michelle, to Neisner as well, to all of the advocates, to the Reverend Dr. Waterman, who was here. This is a moment that we need prayer and leadership from the clergy as well. Republicans have proposed the largest Medicaid cut in American history. It will devastate children, families, people with disabilities, older Americans, women, and everyday Americans in this community, in the city of New York, and across the country. Why have they proposed the largest Medicaid cut in American history? It's because they want to pass massive tax breaks for billionaire donors like Elon Musk and wealthy corporations. It's unacceptable, it's unconscionable, it's un-American, and together we're going to do everything we have to do to stop these cuts from ever taking effect. We're going to hear from a variety of different individuals who will personally be affected by these cuts and or have the people that they care for be impacted and hurt by this Medicaid cut that has been proposed. All across the country, we're having a Medicaid Day of Action to save Medicaid. Here in New York City, in New York State, in blue states, in purple states, in red states, all across America. Medicaid is health care, and we believe that in the United States of America, health care is not simply a right, it is a privilege that should, not simply a privilege, it is a right. Making sure y'all are paying attention. Medicaid is health care. It's health care for the people in this community, in this city, in this country. And it is not simply a privilege to have health care in the United States of America. It is a right. And we're going to fight to make sure that that right is alive and well and save Medicaid in the United States of America. It's now my honor to introduce my sister who represents the neighboring congressional district. We're in the 8th congressional district right now in Bedford-Stuyvesant, and the Interfaith Medical Center is such an important part of healthcare in this community. For the Bedford-Stuyvesant people that I represent, but also for the people of Central Brooklyn that Yvette Clarke represents right across the street in Crown Heights in the 9th Congressional District. She's also the chair of the Congressional Black Caucus, Congresswoman Yvette Clarke.
Yes. Greetings and good morning, everyone. As has been stated, I'm Congresswoman Yvette Clarke, and I proudly represent the people of the 9th District of New York, and I am chair of the Congressional Black Caucus. Let me thank my leader, the Democratic leader in the House of Representatives, Hakeem Jeffries, for today's press conference, and to all of the advocates, professionals who stand with us as we say no cuts to Medicaid. We all know why we've gathered here today, and that is to address the partisan spending bill congressional Republicans passed that represents an extremely direct, extremely dangerous attack on veterans, families, seniors, and everyday New Yorkers. We can call this attack what it is with certainty because it is an assault on health care of our neighbors that depend on it just to live. Health care in our nation was promised to them. And so I'm proud to stand at Leader Jeffries' side for this Medicaid Day of Action, just as I am proud to call myself a colleague to Democrats across this nation who are speaking the same message we are today, relaying the same dangers of this spending bill and standing for the same people and families it will hurt. I also serve on the Committee of Jurisdiction for Health Care in the House of Representatives, the Energy and Commerce Committee. And we have been sent a mandate essentially to cut $880 billion from the federal budget in order to provide space in the budget for the trillions of tax cuts to the wealthiest in the United States of America. This is a humanitarian crisis. And unfortunately, there is a move afoot to make sure that we all are impacted by these draconian cuts. We've engaged in this national mission to speak to millions of Americans across the country who have lived good, decent lives, the people who are now at risk of losing their health care and housing, safer communities, and retirement security due to the cuts made by those who haven't come close to the same standard of decency. In the face of this latest scheme to slash Medicaid, Medicare, and Social Security to pay for tax breaks for billionaires, know that House Democrats will use every tool at our disposal to stop this devastating scheme, but it requires all of us. It is clear that Republicans have put a bullseye on the most vulnerable Americans among us, and we will not sit down and stay quiet while they do. In New York's 9th District alone, the community that I've called home my entire life, cuts to Medicaid will severely impact over 65,000 people over the age of 65, 24,000 disabled children and adults, 146,000 young adults, 85,000 parents and caretakers, 149,000 children, and 11,000 pregnant women. And those numbers up, we can see that these cuts will hurt roughly 500,000 people within my district alone. That's almost half of our district. There are real people who will lose more than $5 million in Medicaid benefits and the services they rely on. I can tell you that you'll see similar disturbing figures across this nation. Republicans continue to rob Americans to fill the pockets of the rich, and their actions are costing lives. Democrats will continue to fight back by holding Republicans accountable. And let me just close with this. Human beings are human beings. They are born into this world without party affiliation. This is going to impact all Americans, all of us. The cascading effect of cutting $880 billion out of health care will not only mean the threat to our health and well-being, it will mean higher unemployment, it will mean the closure of hospitals and federally qualified healthcare institutions within our communities. It will mean devastation at every turn. We have just recovered from a pandemic. We're seeing the outbreak of measles across this nation. This is not the time for the most wealthiest in our nation, the top 1%, to line their pockets at the expense of the health and well-being of the people of the United States. It's time to stand up. It's time to fight back. It is now my honor to bring to the podium at this time Shashina Salvador, one of the constituents of the 8th District, who has her story to share with you today.
Thank you. Good morning, everybody. How are you guys? Thank you, Jeffries and Congresswoman. My name is Shashina Salvador, and I live in Gravesend. I'm also a single woman and a mother to this amazing 2-year-old Aviana, who just celebrated her birthday. I am also a Massachusetts National Guard veteran, and I am a member of Moms Rising. Thank you, Leaders Jeffries, for all you are doing to fight for working families like mine and for the opportunity to share my story today. My family depends on Medicaid to stay healthy, and I am horrified that this critical program is under attack. I first enrolled in Medicaid when I was pregnant with Aviana. At that time, I was working at a child care program, and I did not have health insurance. Medicaid made all the difference for me. Because of Medicaid, I was able to access the prenatal care I needed to maintain a healthy pregnancy. I didn't have to avoid going to the doctor or skip filling prescriptions for fear I couldn't pay. I could deliver my daughter without worrying about going into deep medical debt. And I'm not alone. Nearly half of the births in New York are covered by Medicaid. Since Aviana was born, Medicaid has also been critical for her health care. Medicaid is the reason I can take her for all her checkups that support her growth and her development. It also means that if I'm worried she's seriously sick, I can take her to a doctor. What could be more important than keeping our nation's kids healthy? I can't tell you what it feels like to watch your health care and your baby's health care get debated in Congress like it's a political chess piece. But I can tell you, I feel like Republican lawmakers have their priorities upside down. Billionaires don't need another tax cut. Families need health care. I'm counting on lawmakers to stop playing games with programs like Medicaid and focus on real problems. Problems that are holding our families and economy back. Like the child care crisis. I had to leave my job at a child care program because I could not afford child care. We barely scraped by, and I used to squeeze in DoorDash shifts where I could. Right now I work weekends and care for Aviana during the week, and I'll do almost anything to provide for her, but it's exhausting. In short, Medicaid is God sent for my family. I have no idea what we do without it. The thought of losing Medicaid is chilling. So instead of slashing funds or proposing more burdensome work requirements for Medicaid and SNAP that would punish caregivers, let's invest in the care infrastructure that parents need to be in the workforce and provide for our families. I'm so grateful for Leader Jeffries and Congresswoman and everyone here today for standing up for Medicaid. The program is essential for families' health and well-being, and moms like me will fight. I promise you.
Gina, for your, I want to yield, open it up for questions.
Thank you so much, Congressman Jeffries, and thank you, my Congresswoman. That's my Congressman. I am, yeah, that's where I live. And I'm a pediatrician, but I'm also the kind of physician that runs hospitals. Meaning I have to please make guess how we're going to have. And I want to remind people that this is not just an inner city problem, a brown problem, a Latina problem. It is all our problem. I've worked in many different types of hospitals, voluntaries, municipals, federal, international. And I will tell you that this is going to impact mostly people that live in rural areas more than even urban areas. It is going to hurt all of us. Once a hospital closes, people don't stop getting sick. Once a hospital closes, those people that have had to defer or deny themselves because they no longer had coverage, Medicaid, have to go somewhere when they're very sick and dying, have to go somewhere when they have disease. Where are they going? They're going up the street to the next home, maybe. That ambulance is going to take them to a hospital where Medicaid have comfortably been able to use those services. It's not going to be there. I've run those hospitals also. We have to serve everyone. The person that comes in need will be at the front of the line. We will all have to wait. We're all going to be impacted by these cuts. I also want to bring up one more thing that has not been mentioned, and others will mention, is prescriptions. Prescriptions are supplemented by Medicaid. The control of many prescriptions is through Medicaid. So especially as we age, those prescription costs are going to go up. So all that needed medication that we can barely afford now, we will not be able to afford. This is a problem that affects us all. This is a cut that is going to affect everyone. It is impossible to go forward with these kinds of cuts. And I say that as a physician, a pediatrician, and a member of the community. And thank you so much for being here, the mother that spoke before me. It's not a time of fear, it's a time of action. So let's get going. Thank you.
Good morning. My name is Gary Stevens. I am the Chief Medical Officer of One Brooklyn Health. So when I'm not helping my colleagues run this great institution, I'm in somebody's chest doing heart surgery. But it's important to us that I want us to cast our vision a few years down the road. While there is an immediacy to the impact of Medicaid cuts will affect chronic disease management. And I want you to think brain, heart, and kidney. For untreated hypertension and diabetes is going to lead to heart attacks 15 years from now. It's going to lead to stroke 15 years from now, and it's going to lead to renal failure and increased cost. So it's important that we understand that this cut is really cost avoidance. It's transferring debt to later on down the road. And while we can spend $1 today managing somebody's hypertension, it's going to cost you $100 to manage their stroke by comparison. And I think that's an important part of this conversation. And this debt will come due, and we need to be able to stop it now. The decisions we make today is going to impact the life of that young lady because she's going to be responsible for paying for this. We need to be smart, we need to join this fight, and we need to be joining with the congressman and the leader to make sure that we stop these cuts because it's important to some unsuspecting person out there who is going to pay the cost of this in a few years' time. Thank you very much.
Thank you, Dr. Stevens and Dr. Flores, for your incredible service to our community. Before we open it up, I did want to yield to SEIU 1199. We have the president, George Gresham, who is here. George, I don't know if you wanted to say a few words. And as you make your way over here, let me yield to Michelle, who is a tremendous, forceful community advocate, leader of SEIU 1199 here at Interfaith Hospital.
Good morning, everyone. My name is Michelle Ned. I am a delegate. I'm an employee here at Interfaith Medical Center for the past 42 years, going on 43 years. At this time,
You're good.
can you hear me?
Good.
At this time, we have some serious business to talk to you about today. Media, listen up carefully. Medicaid and Medicare cut in this community is unacceptable. Mr. Hakeem Jeffries, our Speaker, Congresswoman, this information needs to get back to Washington. This is no joke. Look at where you are. This is Bedford-Stuyvesant. In this community here, we need the funding. We cannot tell patients that come to our doors through this ED that we cannot see them. We have to treat every patient that comes through this door as if they were at Mount Sinai and all the other North Shore hospitals. If we don't get funding, we will not be able to serve this community. I started off in healthcare early at the age of 12 because I had to get in the back of an ambulance every week to take my mother to this very hospital, St. John's at the time, because of asthma. If she did not have insurance, she would not have been seen and she would have died. Again, the message is that we need funding. We are a part of a safety net hospital, OBHS. We don't get money unless it comes from government subsidy. So at this time, I'm urging every one of you to take this message back. We need the funding. Do not cut Medicaid. Do not cut Medicare. The community needs it. We will not have staff to work if we don't get the tools to work. At this time, I am pleading to you, Mr. Jeffries, bring this message back. And thank you all for hearing me.
Thank you. Can you, can you hear me now?
Yes.
Good morning. Humanity. And that's what we're doing. Over 60 years ago, Dr. King said to 1199 in a speech to us that of all of the discriminations that occur in this country, the most egregious was that of health care. That was 60 years ago, and is as true today as it was then. We cannot sit by and allow those who have the resources that would last them 3, 4, 5 lifetimes to say that they're going to cut money out of Medicare, out of Medicaid. Have they lost their mind? Or do they think we've lost our mind by allowing them to do that? And so we in 1199 are going to speak up as loudly as we can, because the consequence of not doing that is death. People don't like to be dramatic, but I'm not going to sanitize it. That is the reality of what happens. People, when they no longer have primary care that they can get, the emergency room becomes their primary physician. If you go into the average hospital now, into the emergency room, it looks like a mass unit. Just imagine, if you will, what will happen. And as was said before, we did not expect the last pandemic imagine how wise we would look if we allow $880 billion to be transferred out of healthcare to give people a tax break, and we get hit with another pandemic. This community knows well what it feels like to be hit by a pandemic because we had the highest deaths in this community. Because COVID really was a symbol of survival of the fittest when it first came out, when we didn't have a vaccine. And so those that were not getting the best care, period, were the ones that were to die the quickest. We cannot put that burden on Interfaith Hospital or One Brooklyn Health Hospitals or any hospital in Appalachia in the South. They may not look like us, but they are humans. They deserve the same quality of care. Life and healthcare should show no humanity. Your healthcare cannot depend on your zip code or your life expectancy. And so we urge you. Sometimes we are quiet. Me, as the president of 1199, it's my privilege to speak for 450,000 healthcare workers in this country. Congresswoman Clark, it's her privilege to speak for the areas that she represents in Brooklyn. The same with our leader, Hakeem Jeffries. But there comes a time when we must speak for ourselves. Everybody needs to hear this voice. I do not have the voice of 450,000, but I'm going to work very hard to make sure that the 450,000 stand. What we need, the beginning of this country was founded because things were not being treated right. I say today, we need a nonviolent healthcare revolution in this country. Let's all stand. There's nothing more to say. Let's just do the work. The work got to get done. We cannot afford for that cute little sweetheart, wherever she is. We can't think about it. They're taking away our future. How dare they? So they can get a lower tax break. Have they lost their mind? Or do they think we've lost ours? Thank you.
Questions?
Good morning, Leader Jeffries. It's been mentioned that Democrats are willing to use every tool in the toolbox in order to fight these cuts. Can you give some specifics as to what those tools might be? And then also recent days we've seen what appears to be some division amongst Democrats in Washington, with some House members being very critical of Chuck Schumer. Can you talk to whether or not you are standing by Chuck Schumer? Do you feel like you're able to unite Democrats, particularly at a time like this?
Sunday, we had a good conversation about the path forward, particularly as it relates to making sure we all speak with one voice in the effort to stop these Medicaid cuts from ever being enacted into law. All across the country, led by House Democrats, we're having a Medicaid Day of Action, engagements, site visits, town hall meetings, press conferences, interactions with our constituents, hearing from healthcare providers all across the country to elevate their voices to make sure that the American people understand that this is a matter of life and death when it comes to saving Medicaid. And so the next few weeks in Washington, D.C., Republicans are going to try to jam this budget down the throats of the American people. Every single House Democrat and every single Senate Democrat voted against the initial budget resolution at the end of February, and we remain united in stopping these Medicaid cuts. Thanks.
Leader Jeffries, you and Leader Schumer issued a joint statement about Medicaid and the threat today. Why isn't he here now, and when do you think you'll appear together on this cause?
Yeah, I assume that he's participating in other engagements throughout the state, but Senate Democrats have been very clear. They're partnering with House Democrats to stop these cuts from ever taking effect. Understand, these are the largest Medicaid cuts in American history, and Medicaid is a vital health care program for over 90 million Americans, millions here in the city and across the state. Women and children and families and seniors and Americans with disabilities all rely on Medicaid to get their health care. It's inhumane what the Republicans are trying to do. And we're going to expose their scheme all across the country. It's a scheme to jam these massive tax cuts down the throats of the American people for their billionaire donors and wealthy corporations who don't need it. And then they want to force working class Americans to pay the bill by robbing working class Americans of their health care. We will not let it happen.
That's right.
Marshall.
Leader Jeffries, I note that you and Chuck Schumer issued a joint statement a while ago supporting this Medicaid Day of Action, so there's unity on this. But Mr. Schumer actually was on CBS this morning, and he was talking about his controversial decision to let the continuing resolution go forward. And what he said today was sort of interesting in that he said that he was told by a Republican senator that if they didn't do this bill, that there would be a shutdown of government between 6 and 9 months, and that the damage that the Republicans could do in terms of furloughing people and stopping this economy could be devastating. So I wonder if now, after the dust is cleared and the smoke is cleared, if you can somehow see his logic in the decision that I know you didn't like about his decision to try to let the government go forward.
Well, you know, as House Democrats, we stand by our decision to oppose the Republican spending bill because the partisan Republican spending bill that was not negotiated with Democrats, it was written by Donald Trump and House Republicans, would hurt families, hurt veterans, and hurt seniors. It would cut health care, cut veterans' benefits, and cut nutritional assistance from children and families all across America, including in the communities that Congresswoman Clark and I represent. So that was not an acceptable thing for us. Our view was that the choice was between voting down the partisan, reckless Republican spending bill and then forcing Republicans to explain why they were unwilling to accept a 4-week spending agreement that would simply allow Democrats and Republicans to try to arrive at a spending bill that would meet the needs of the American people. It was the Republicans' choice, in our view, to potentially shut down the government, and they would have to explain that to the American people.
But if I could just follow up, if you could just tell us how you feel about Chuck Schumer's decision to do what he did and the fact that he continues to take incoming bullets day after day after day and it hasn't stopped. Is that right? Is it wrong? And do you support his leadership of the Senate?
Yes.
Yes, what?
Yes, I do. Thanks.
Thank you, Mr. Leader, for doing this. Recent polling over the weekend from NBC and CNN showed that Democrats' favorability is at a record low. Do you see events like this, these local events with constituent stories, as a part of the strategy to help rebuild the Democrats' brand on the national level?
Yeah, this is not about the Democratic brand. This is about the American people and the folks whose health care is under assault. I think that the politics of this will take care of itself, right? And it'll take care of itself as early as next year in the midterm elections. But right now, it's about stopping these extreme things from happening that are wildly inconsistent with what Donald Trump and Republicans were talking to the American people about last year. All last year, Donald Trump and Republicans were talking about they were going to drive down the high cost of living in the United States of America and rebuild the economy. Their words. And then they were running away from Project 2025 as if it didn't exist. This year, they've done nothing to improve the economy, nothing to drive down the high cost of living in the United States of America. We believe that the cost of living is too high and that we have to lower housing costs and child care costs and the cost of groceries and insurance costs and utility costs. We as Democrats want to work on that. Republicans have done nothing to improve the economy. In fact, costs aren't going down, they're going up. Inflation is going up. And Donald Trump and the Republicans are crashing the economy in real time. and potentially driving us toward a recession. So they've done nothing on the economy, and everything we're seeing is all part of Project 2025, which they claimed didn't exist last year, and now they're trying to jam it down the throats of the American people. They lied to the American people. We're going to hold them accountable. The politics will take care of itself, but I'm very confident that next November, we're taking back control of the United States House of Representatives.
You know, I think that the way that this has been constructed is incorrect. Like I said, human beings are human beings. We are not born into partisan politics. We are born into a life that we expect will respect human dignity. And here we are, 2025, with a new administration that has demonstrated that they value some lives over others. And we cannot stand as Americans, regardless and irrespective of political party, and just take it. We have to fight back. This is about the lives that we lead, whether you're Republican or you're Democrat. Without your health, nothing else matters. And so we are appealing not only to Democrats, but to people of goodwill, irrespective of party, to stand up. Stand up for your neighbors. Stand up for your coworkers. Stand up for the families. Stand up for those you worship with. Because in this moment, we will all be paying a dear price if we don't stand up.
Last question. Last two questions.
David Jeffries, you said that you support Chuck Schumer's leadership. There are some in your caucus who disagree and have been sharply critical of him. Do those voices, AOC, Jasmine Crockett among them, does that help Democratic unity? And have you urged your caucus to align itself with Schumer and the rest of the...
Yeah, we're all aligned on the fights that are in front of us on behalf of the people that we represent here in Brooklyn and New York City and across the country. And that's saving Medicaid, saving Social Security, saving Medicare, all of which Elon Musk and Donald Trump and the Republicans, they want to take a chainsaw to Medicaid. They want to take a chainsaw to Social Security. They want to take a chainsaw to Medicare. But let me be clear, we're going to take a chainsaw to Project 2025.
Peter Jeffries, this is just kind of a clarifying question, but I do just want to underline it. Does this mean that you do have confidence in Schumer?
Yes. Thank you very much.